Hi guys, welcome back to Fitness Friday, and I am here, Dr. Mahima Bakshi, Women and Child Wellness Consultant at Rosewalk, along with Dr. Veenu Sharma, Senior Consultant Anesthesiology. Hi, ma'am.
Hi, Mahima. Hi, everyone.
So we are back again with our Fitness Friday episode, and our today's topic is breathing and relaxation in pregnancy, which I think is a very, very important topic. What do you say, ma'am?
Of course, I think it is one topic which really needs to be addressed, and it can take care of a lot of other problems. So, a well chosen topic.
Yes, so a lot of times, people are not focusing a lot on practicing the right kind of breathing and relaxation techniques because they think, there's no bigger deal to actually sit and do breathing exercises or relaxation exercises. But yes, like you mentioned, it can actually help in taking care of a lot of other conditions also. So overall benefit would be very, very good, especially for pregnant moms.
Right, right.
So I'll
I
start off with our first question. So, ma'am, please tell us something about how can one practice mindfulness and what exactly is mindfulness?
Yeah, that's a very good question, Mahima, because most of us use this term, but it means different things to different people. So, the definition I like about mindfulness is that mindfulness is being present in being aware of the present moment without any judgment. And when I say without any judgment, I mean that being present in the moment without adding any emotional charge to whatever's happening or whatever your thought process is.
Mm-hmm.
It is a very simple and yet effective way to keep stress away. And I mean, nothing can be simpler than that. But as a generation, as people, we have gone really far away from this. We are anywhere but in present. We are either in past, future, multitasking. So I think to understand mindfulness is a very basic thing if you want to keep your levels of stress low.
Yes, and I think, in fact, a lot of people, whenever they are doing any particular activity, or even if they are spending time with their loved ones, back of the mind, they're always thinking something else, and they're not able to give their 100% mentally into what they're doing.
Yes, back of the mind, and even at the same moment, they are doing more than one thing. They're talking to the person on the phone, they're talking to the person in front of them, then they're thinking something else, and there's something else going around them. So if one just takes a closer look at our everyday lives, we really are never mindful of whatever we are doing. We think we are mindful, but we are not, and that adds to a lot of stress. If we start doing that, if we start following some degree of mindfulness every day, we will keep stress away. And why stress is to be kept away, I think I would answer that also for obvious reasons. And secondly, stress does at a physiological level, stress can really damage body because stress would mean a higher blood pressure, a higher heart rate, higher respiratory rate. And also it would mean if it's sustained for longer times, it would mean it would affect your digestion, it would affect your immunity, and in a long term it could lead to a lot of diseases. There are a lot of studies have been done, and stress has been related to so many of the diseases, the common ones like cardiac, blood pressure, diabetes, we all know, and we all see a lot of these diseases in pregnancy also. So the correlation between stress and diseases is quite a lot, and mindfulness is one of the simplest ways to take care of it.
Right. So, since you've mentioned all these diseases, if we talk about the first trimester in pregnancy, a lot of moms are also experiencing nausea, vomiting, and then anxiety and stress adds on to aggravating the nausea, vomiting. So, then in that case, how can mindfulness help a pregnant woman?
I think by being aware of, see, now, first of all, understanding that these things will be there and they are there for a short duration of time, whatever the discomfort is there. And then, secondly, the simpler techniques of mindfulness anyone can follow. It can be anything like eating mindful while eating food, what to eat, what signals your body is giving you at that moment, to a little more structured way of doing mindfulness that would be in the form of some yoga, some kind of meditation, some kind of breathing exercises. Or if you're already practicing other forms of fitness like tai chi, pilates, they all focus on doing something along with focusing on your breath. These are very good ways to incorporate mindfulness in first trimester of pregnancy.
Right. And now, if we move on to the relaxation and the breathing part, so how important is it for a pregnant mom to practice relaxation techniques and breathing exercises during her pregnancy?
As I said, the harmful effects of stress are many. And in pregnancy, this translates if a person is stressed out, then this would translate to, the effect being transmitted to the fetus also. So if mother's physiology is going haywire, obviously some degree of uteroplacental blood flow will be affected, some degree of discomfort, which translates into, like I said, raised blood pressure, raised heart rate. That would all be transferred. Those physiological changes will be transmitted to the fetus also, the baby also. So it is very important that one is aware of all this and one takes all the measures so that, if the mother is in great health, emotional and physical, obviously the baby will be in great health. There's no doubt about it. So it's very important that right from first trimester, all these things are followed. These things, a person becomes aware of the stress and mindfulness, that right from first trimester, which is very important in terms of it's like a formative trimester where foundation for everything is laid down, so that all that is done in the best possible way.
So, right. So, then if we talk about what are the various ways in which they can do it, so what would be your suggestion on that?
Yeah. So, okay, so that would be, as I said, doing simple breathing exercises, focusing on your breath. But here I would like to tell you that there are certain don'ts which a pregnant woman should be aware of. Anything that involves a very forceful, control of breath. For example, there is, if you talk of pranayam, there is something like a, forceful expiration there in Kapal Bhati. These things should not be done. Anything that is smooth, that does not involve any forceful inspiration or expiration, anything that does not involve holding of breath for long or even for a shorter duration of time, that should not be done right from first trimester. Rest, everything can be done. uh, One can even do simple things like walking and focusing on the breath while walking, so that some awareness is brought into walk and your mind gets away from the usual stresses and strains of life. And simple yogic postures which do not involve any inversion, too much of bending forward, lying on your tummy for obvious reasons, can be done. In first trimester, you can lie down on your back and practice yogic breath, which is, your diaphragmatic breathing, abdominal breathing, practicing it in a rhythmic manner without any jhakas. All that can be done.
Right. Well said, because yes, breathing relaxation is a very, very important topic in pregnancy, especially during the first trimester, because that's when you need it the most. It will help you to control a balance between your hormonal changes happening in the body. It will give you better emotional control. And also, it will help in reducing stress, anxiety, which could probably aggravate your nausea, vomiting, which is the most commonly seen sign in the early trimester when mothers find it very difficult to even focus on eating food. So you can also add on some more breathing relaxation techniques by practicing deep abdominal breathing, which gives the immediate effect, which is also practiced during the Lamaze breathing that is done during pregnancy and labor. You can simply inhale through your nose and in your mind just count 1, 2, 3, 4, 5 and keep inhaling during those 5 seconds, and then exhale through your mouth as if you're blowing off a candle, and that is going to be your slow expiration. So when you blow out, let that go, let the air get released gradually, slowly, and that's when you can do the count in your head and go reverse. So 5, 4, 3, 2, 1. When we do this, we practice it with the movement of the abdomen. So you can place both your hands on your belly. When you breathe in, let your tummy come out as if you're taking in a lot of oxygen, you're filling in a lot of air, and let the abdomen spread out while you breathe in. And as you breathe out, let the tummy go in so that you're able to release the maximum carbon dioxide out of your body. and the abdomen just kind of squeezes and contracts, and then your abdomen is going in. So the movement of the abdomen is what has to be focused upon rather than the movement of the chest when you're doing deep abdominal breathing. And at the same time, you practice inspiration through the nose and expiration through the mouth, which is again another form of deep breathing. And these two combined breathing techniques gives superb relaxation. For even better results, you can combine it with some form of music therapy or aromatherapy. You can just play some enchanting music in the background, and you can put up some diffuser candles or some aroma candles, scented candles and scented sticks, and combine it as a relaxation technique which can be done easily for 5 to 10 minutes on daily basis. So ma'am, any comments on that?
No, that's very well explained, Mahima. I think you've covered most of it. I would just say that sometimes you can even combine stretches with your breathing, and
Yes.
that would lead to additional physical advantages also. Otherwise, that's an excellent way of describing relaxation technique with candles and music. That would definitely give an added effect to the whole thing.
Absolutely. So we can combine this with chest expansion exercises, which will again create more space for the lungs to expand and hence improve the breathing. And for that, you can combine in a lot of stretches along with the breathing exercises. And if you want to know more about what kind of breathing relaxation techniques you can practice in pregnancy, don't forget to get in touch with us for our well-being program called Bump Prep, through which we help moms in pregnancy to practice the right kind of physical well-being and emotional well-being techniques to help them take care of themselves during the pregnancy and the postpartum period. So, ma'am, any final takeaway message for mothers who are watching you right now on breathing relaxation and mindfulness?
I would just say that it's important to recognize stress because you can only change what you acknowledge and recognize. And even smaller acknowledgement is half the job done. And then please add some form of mindfulness technique to your daily routine. It need not be complicated, it need not be very structured. Just add it so that stress levels are away, and especially in these COVID times when you're stressed about so many things and how your pregnancy would be, how your delivery would, eventually follow or result in. Just follow the relaxation techniques, whichever is your favorite, and continue with them and just stay safe.
Absolutely. We'll be very happy to answer questions now. So if you have any questions related to breathing relaxation in pregnancy, you can start sending us questions. Until then, ma'am, I would also like to ask you about how you practice mindfulness in your life.
I'm very fond of yoga and Pilates, so they are my go-to techniques, and maybe a few minutes of meditation in the morning. No, nothing complicated, just focusing on the breath and sitting with myself and just being. If there's some natural sounds around, I think that just works for me well.
We have our first question from the audience. Anita is asking, why is it hard to breathe when I lay down while pregnant? I assume she's talking about her pregnancy period. So why is it difficult to breathe when she's lying down during her pregnancy? That's what she meant.
Is it, see, in second and third trimesters, as the uterus is growing because of the baby, because the baby is growing, so the volume and weight of the uterus pushes the diaphragm, which pushes the lungs, and that is why it's very difficult to take a deep breath when one is on the back and lying down position. I think that answers your question. So that's why it's important to lie down on your side, or
Yeah.
be in a semi propped up kind of a position so that your lung gets some space to expand and the uterus doesn't push the lungs up.
Yes, absolutely. Well said. So that's why your lying position has to be properly placed. Use pillow support and make sure that you spend more time lying on the left side after the first trimester. During the first trimester, it's okay. You can enjoy lying down flat on your back,
Yeah.
and keep practicing breathing relaxation exercises because that will improve the chest expansion and the lung expansion, and hence it will be easier for you to cope up during your second and third trimester. We have another question. Nancy is asking, how do I know if my baby is not getting enough oxygen?
Well, if you are getting enough oxygen, why should the baby be getting enough oxygen? Unless there is something, which has been diagnosed on ultrasound and there is something wrong with the uteroplacental flows or things like that. If you are fine and if you're getting well oxygenated, the baby is likely to be well oxygenated. You don't need to worry about that.
So you can just keep on improving your breathing stamina, your relaxation exercises, chest expansion exercises, and automatically the baby will get benefited from it.
Yes.
And we have the next question. Pooja is asking, hello, ma'am. I'm in my third trimester. Is shortness of breath normal in third trimester?
Hi, Pooja. Yes, some shortness of breath can happen because of the reasons I mentioned, because of the weight of the uterus and the baby pushing on the diaphragm and all those physiological changes that have taken place. But if you notice any acute shortness of breath which was not there, and if you feel that the shortness of breath is interfering with your daily life, then you need to get yourself checked up for any added any added stress or anything that's not going right with the pregnancy. But otherwise, some degree of shortness of breath is quite normal in pregnancy, especially in third trimester.
Yes, especially in third trimester, and that's why you should get into a routine of doing your breathing relaxation exercises every day so that it improves your breathing stamina, your endurance, and hence making it easier for you to cope up in the third trimester. So I think you should start doing your breathing relaxation exercises right from today and spend more time on it.
True.
We have another question. Rachna is asking, hello, ma'am. Please just some good, okay, sir. Please suggest some good breathing exercises to do during pregnancy.
So Rachna, if you've been doing them before, then as I said, eliminate the ones which cause some kind of forceful inspiration, expiration. If you're new to this, then whatever Mahima said, that abdominal breathing, when you breathe in through your nose, she described the Lamaze technique, the count, or just simply focusing on your breath and attempting to take a deep breath in and exhaling with full awareness and counting the breath, and like with the count 1 to 5 you inhale and 1 to 5 you exhale. You can do it through the nose and exhalation can happen through the mouth. This is the simplest way to start focusing on your breath. Other breathing exercises, I think with the Lamaze techniques and all, you could just explain them if they want to do it on as a separate class.
Yes.
And yeah.
Yes, ma'am. So, like you said, there are different kinds of Lamaze breathing techniques that also helps the pregnant mom during her labor. So, if you want, you can attend our Lamaze session in which we'll be able to guide you upon all the different Lamaze breathing techniques and help you prepare for your labor as well.
But you can obviously start from the simpler exercises which we just described.
Yes, so you can do the simple deep breathing, the abdomen breathing at home. We have another question. Sapna is asking, hello, ma'am. I'm a BP patient and I get hyper easily, and it's my 6th month. Please share some tips for relaxation.
Sapna, I mean, it's good that you're aware that you get hyper, and I think the kind of atmosphere we are in, it's not something very rare. People are getting hyper about a lot of things nowadays. And since you said you are a BP patient, it's very important because that would act like a trigger to, for your BP as well. So I think one important thing is to identify the triggers. Um, what is what is it that gets you hyper? If you're aiming at perfection and if things don't go your way, if these are the kind of triggers, then I think it's good to be aware of them, and it's good to have a system, a thinking system around them. For example, if you're aiming at perfection, things are never going to be things are never going to be perfect. They'll always be there will be something, sometimes things don't go your way. So these kind of things you can keep in your mind. Maybe prepare a mental or even a physical list of all the factors that drive you to the edge. And other tips for relaxation would be simple abdominal breathing exercises and just sitting, having some 15-20 minutes per day of introspection. Taking regular walks, and you can coordinate walking with your breath. That is also very relaxing rather than walking and continuously thinking about something. Then you can coordinate stretches with your breath. The various types of stretches wherein you inhale while doing a particular stretch and you exhale while going back to the position. So depending on what you're doing and used to, all these things, if you incorporate in your daily schedule and you persist and you really do them regularly, they'll go a long way.
Right. And if you get hyper very easily, the best way to cope up at that time is to just distract yourself. Huffing and puffing is also a very great way to do that. You can just simply start and then take a deep breath and then just distract your mind if you're getting hyper very easily. And different ways to distract yourself could be reading, could be watching something that you like to watch, could be listening to music. If nothing else, you could just pick up your phone, call up your best friend and talk to her. But try to distract yourself at that time when you think that you're getting very hyper, and make sure that you don't let yourself go into that state, because you can control the early hyper activity of the mind. And especially if you feel you're a BP patient and if it's your 6th month, the moment you feel you're getting hyper, you're going into a panic state or a hyper state, just quickly distract yourself and then try to move on to a different kind of breathing, which will also help in relaxing your mind at that point of time. Taking control of your mind is very, very important, because that will help you during your labor as well. And hypnobirthing also works on the principle of controlling the mind while birthing. So you can start practicing some hypnobirthing techniques in pregnancy, which will also help you to take control of your mind.
Yeah, that's quite well said, Mahima, because one thing I would like to add, that when you're hyper, if you are able to get your breath, if you are able to establish a deep and rhythmic pattern of breathing, soon you will come out of that unresourceful state. So, as she said, you can distract and then eventually focus on your breath. That will really help you at that particular moment.
So I think we are done with the Q&As. We had some lovely questions from the audience, and we would like to thank all of you for joining in today for our today's Fitness Friday episode. It was lovely chatting with you all. And thank you so much, ma'am, for sparing out time. It was lovely interacting with you once again over a
Thank
Friday
you.
Fitness episode.
My pleasure.
And it's always great fun for us to come with different topics, because we want you to enjoy your pregnancy as much as possible by staying safe and healthy at home.
Yeah. Bye, everyone. Stay healthy, stay stress free. Bye. Thank you, Mahima.
And keep practicing your breathing and relaxation techniques.
Yes.